We're here because of the affordability crisis in healthcare. Healthcare costs too much, particularly for patients, for consumers in general, and for small employers and large employers.
I understand that you guys had a lot of options and you chose to come here to talk about healthcare affordability, which sounds like a fun time for me.
I think it's the first event in Idaho that's having a focused conversation around affordability, getting a variety of different stakeholders, employers, providers, legislators, different business groups to be involved in this conversation, I think is really, really important.
Healthcare represents 20% of the nation's economy. It's 1 in every $5 that we spend. It's a real kitchen table issue. They're making choices between whether they're going to refill their prescription or they're going to get their groceries this month.
I can have the sickest patient calling me and they want to know, how much is it going to cost? How much is that prescription going to cost? I try to reassure them I'm writing for the least expensive, and I often wonder, are they going to go get that? Cost is always an issue.
There's a lot of things that individuals can do and that businesses can do to manage healthcare costs. But ultimately, government officials need to step in to address some of the problems in the healthcare marketplace. So we're asking both private sector purchasers, health plans, hospitals, physician groups, and policymakers to step up and fix this problem.
There's a lot of pieces that we could work on. We do have issues in Idaho with the rising cost of healthcare, just like we do across the nation. But I think the Idaho legislature can help.
It's important to get stakeholders to the table and really investigate what is driving up the costs. We all need to take a part in that and get to the bottom of it. Whatever that is, we are creative people and we can solve those problems.
This was one of the best presentations I've seen in all the time I've been in the legislature because it dealt with the facts. We need to all work on the solutions together. We spend way more on healthcare than all the other countries, but our life expectancy is going down compared to other countries. So what are we doing wrong?
When you talk about healthcare, you're representing people from birth to your most elderly, and I can't think of a more important thing to talk about.